Hey everybody, Tim Lew from SVB. I run the life science team on the West Coast, really focused on seed and startup banking here. But wanted to share with you guys our healthcare report, which dropped about 2 or 3 weeks ago, and a lot of data here and a lot of cool things. Unfortunately, I'm coming at the end, so a lot of the things are going to be talked about, but would love to share the report with you guys. So I'll drop that in the chat at the end. Just wanted to put a little bit of a plug in as well. SVB has a number of reports that's available publicly. So every 6 months, we drop a investments and exits report talking about the state of healthcare, as well as state of the market reports for the broad market. We also have specific reports that go into fintech, climate tech, and tech. So if you guys need any of those reports, they're always available online. You can put that in the chat at the end. But wanted to focus on specifically on this last healthcare report, and maybe give some insights that we had from SVB. The report's broken up generally into highlights, kind of the fundraising and investment broadly on what's going on, who the active investors are by segment. The segments, we break them up to our biopharm, so that's biotech, health tech, digital tech, tools and diagnostics, and lastly, we focus on medical device. We also have two spotlights that are within the report, and that's going to be this on this one. It's going to be biopharma AI, which is obviously very hot. A little bit about de novo proteins, and then also a little focus on early stage, which we're calling seed and Series A. So I'm going to dive into some of the stuff and give some insights here. I hope it's valuable for everybody. Just starting off here, we're going to kind of go over the market highlights, very broadly. Big picture stuff, you can see $5.6 billion was invested in 2024 in biopharma AI. As everyone has noted in the, over the last couple talks, AI is hot. That sector specifically has grown 3x year over year. Another big highlight here is that 40% of all the deals in the last H2 of last year were in the seed rounds. So, maybe we're reloading, maybe we're getting ready for something new. And then as you can see, there's some specific highlights here in biopharm, health tech, tools and diagnostics, and device. I think this is a really neat slide. It goes over kind of the broad overview snapshot of what has happened over the last few years. It gathers all the data from those sectors. It really talks about, and you can kind of visually see where things are. Just some quick highlights here. You can see that, biopharm has kept relatively stable. It's really the hot market. I think Matt had talked about it earlier. But you can see the slow kind of increase going up as things are hopefully ramping up towards an upward cycle. We're hoping that this is the start of a cycle, and that we'll see things beginning to creep and climb as the year goes on. Wanted to just highlight this slide here. So this really talks a little bit about the biopharma, biotech, AI investment surge. Obviously everyone knows about the big deals. Zara, $1.1 billion. You can also see some other things here. I think there was some conversations maybe 2 talks ago about the efficiency of AI. I wanted to specifically focus here on biopharmaceutical AI. We had an interview with a postdoc fellow from the IPD, the Institute of Protein Design at UW. David Baker just won the Nobel Prize, and it was interesting to talk to him about, how is AI affecting your guys' lab? And the interesting thing was, scientists are always going to stay scientists, and they're going to do their science things. But specifically, where is it going to help? It's really going to help with efficiency. And so you can see a quote here: what used to take 3 months now takes 3 days. And so that's an incredible efficiency. I mean, we're talking billions and billions of dollars, even on the level of people, headcount. You're taking somebody's time from 3 months to 3 days. And then lastly, just wanted to talk about, maybe the other side of it. AI promises to have the likelihood of success in these drug developments, but we've yet to see these drugs actually hit, humans and have a really big impact. So I think we're going to see some impacts on the AI drug discovery in a few years, yet to be seen, but lots of excitement there. Moving on to our next slide here, this really talks about the AI revolution in protein design. you can see on the right here, what are all the possible proteins that can ever exist, and how many exist in nature. I mean, there's an infinite possibility here for creating kind of new, novel de novo proteins that can really kind of change the landscape of what we're doing on the biopharm space. And then moving on to the seed stage, so this is another spotlight that we had. We're focusing here on, the early stage of companies, and what you can see is that a couple things you can see here. Number one is you can see that Series A's are taking longer. So seed and Series A deals have longer development cycles. So you're seeing an increase in the number of median months that it's taking companies to get from seed to Series A. You're also seeing a kind of a nomenclature shift. What used to be a seed, what used to be a Series A is no longer kind of, that kind of all mixed up. And then, obviously we're just seeing a lot of seed deals coming in the pipeline, but smaller in revenue size. And lastly, exits. What does the light look like at the end of the tunnel? Interestingly, you can see here there was more M&A activity than IPO activity. So what does that mean? Perhaps there's an increase of the pipeline being refilled. I think somebody else brought up the idea that these companies, a lot of companies have patents that are expiring. So how are they going to refill their pipeline? And the last thing I wanted to point out here is if you look, there's a focus on oncology and kind of metabolic diseases, and where's the money going? And a lot of stuff also in CNS. I've seen a lot of stuff in neuro. And closing things out, just wanted to let everyone know there's other reports that we publish, not only healthcare, this is investments and exits, so broader. We also have one focused on health tech, kind of digital tech. We have one focused on AI, and we're going to drop a women's health report coming up, I think, in a month or two. And would love to connect with anybody. Please let me know, and I'll put the link for some of the reports in here at the end.
It's fantastic. Really appreciate it, Tim. And just last couple of minutes here, did you have any perspectives and any insights on the JPM meeting 2025 that you'd want to share with folks?
Yeah, I think everyone was kind of, trying to understand what is the market going to be like, to use the analogy, are we out of the woods? Are things warming up? And it feels like things are going well. All signs are pointing, there. I don't think we're there yet. We're not around the corner. But there was a lot of excitement. I mean, obviously AI and women's health were kind of the hot topics. I think everyone's talked about that. But it was just really good to connect. It felt like a JPM that was reinvigorated. A lot of people out, a lot of meetings, a lot of good conversations, a lot of positivity.
Yeah, just incredible meeting. Agree with you about the kind of the sense making people were doing. What's going to happen this year? Or people are trying to consolidate portfolios. They're trying to find ways to make more with less, and they're trying to find ways to get partnerships and alliances done by the bundle. And in terms of 2025, and kind of the read that you just gave us, what are some of the, if there was like one sentence that you would say is going to define 2025, what would you say that would be?
I guess it's hard to say. I mean, and maybe I'm just speaking like everybody else, but AI is just table stakes now. Everyone has to have AI involved in their companies. How do you use it? And I heard some really interesting conversations about AI being kind of AI native, or AI kind of built in. And when you take AI and you try to put it into your company, it's kind of clunky. So I'm interested to see too how some of these native AI companies that are hot get kind of pulled into these bigger, organizations and an M&A activity, and what that's going to look like. I know that wasn't kind of one thing, but yeah. And lastly, I'll just say, I think the IPO and MMA activities in Q1 will really dictate what it's going to look like for the rest of the year. So really appreciate the time. And again, these reports are available to anybody, and hope everyone can use them.